See, Dr. Cleveland, good morning, sir. How are you?
Good morning, Paul. I'm well. How are you?
Good, and staying alive, the Bee Gees. That was what, 1844, I believe.
If it was, I was alive in 1844. I remember that song very well growing up.
Well, let me just say this: our bones were easier to dance to back then, or without any undue harm. I'm reading over this bill, and it seems like a major rewrite. Tell me exactly what we're talking about. The bill number, if is it a House or Senate bill?
So right now, I don't think it's been assigned a number.
Oh, it hasn't? Okay. All right.
We're waiting on that to happen probably today. And we're definitely looking at getting it introduced on the Senate side, and I think most likely on the House side as well.
All right. Tell me exactly what the bill would do and the need for the bill, the rewrite on this.
Well, the Medical Practice Act in Mississippi hasn't been seriously updated in well over 25 years. I mean, probably closer to 30. And I think we can all agree that the practice of medicine has changed significantly in 25 to 30 years. And especially even since COVID, the practice of medicine has changed rapidly. And, you know, we're trying to protect the safety and the health of Mississippians. And we need to update our Practice Act to be able to do that. We need to keep up with technological changes, with being in a global atmosphere where people can practice medicine into Mississippi from anywhere in the United States and really kind of anywhere in the world, whether it's being done legally or illegally. With the telemedicine, people can reach into Mississippi very easily.
Yeah, when this was written originally, the word telemedicine hadn't been invented yet, I don't think so.
I'm not even sure the Internet had been invented.
Well, that's very, very true. I'm worried about one thing here because this is rather extensive. Is this the first time the legislators, or certainly those people on that committee, will see this, or have they had a chance to look over this earlier?
Believe it or not, Paul, I've been the executive director of the medical board for 5 years now, and this was one of my main goals coming in. And the main goal of the board when they hired me was to update the Medical Practice Act, to modernize it. Okay, and so each year since I've been executive director, we have introduced a version of this bill. Now, every year we learn from what did work and what didn't work, and we make modifications to it, and we do other things that try to enhance the ability for the legislatures to be able to pass this act and modernize the practice of medicine in Mississippi.
To the legislators who are listening, how important is this for just the people? For them to, I understand it's complicated, it's long, but they need to pay attention to it because it does sooner or later get back to the people of the state.
Well, the medical board needs this to be able to protect the health and safety of the people of Mississippi. And I think we're falling further and further behind. Every year we don't update this with technological changes, telemedicine, interstate licensure, all these things. You know, we're up about 3,000 licensees just since COVID. And if you look at our overall numbers, we have a little over 12,000 licensees, and that are people who are licensed to practice medicine in the state of Mississippi.
That is strictly those under the title of doctor?
Doctor, PA, and podiatrist.
Okay.
And then
one of the changes here is you want to change the clarification of the term physician applies to MD and DO, or is that a change? Or
well,
is
that's a clarification more than anything. Back in the
doctor of optometry?
No, doctor of osteopathy. So
okay.
MD and DO, DO schools didn't really become popular until the late 80s and into the 90s, and people kind of didn't look at them as equivalent medical degrees. But certainly in the year 2023, we think they're equivalent medical degrees, and that an MD and a DO are equally effective at practicing medicine. So we just wanted to remove duplicate references and incorporate both MDs and DO into the one-term physician. So,
some of the other things in here that need to be changed, if you want to allude on, because I'm reading over these things and there's just so much, but we have limited time, and I wanted to make sure you cover the ones that you think just absolutely possible. Because in some cases, in whole paragraphs are that you struck out.
Right. So, one of the things that is struck is it's actually in the Medical Practice Act that the medical board is supposed to meet down at the Capitol to examine new applicants to make sure that they're qualified to practice medicine in Mississippi. Well, that hasn't been done since the late 80s. Okay. I mean, there's been national standards for testing and licensing in the United States. The USMLE and the FLEX exams go back to the early 90s. And so that's just antiquated language. There's a lot of antiquated language throughout this bill or throughout the Medical Practice Act that we're striking with this bill. And then there's things that we're trying to add to give us better ability to protect people.
Anything in that affects the scope of practice changes?
This absolutely has nothing to do with scope of practice for nurse practitioners. This is all about physicians and PAs and podiatrists. Those are just two completely different categories and subjects, and, they shouldn't be confused with each other.
Yeah. Does it change anything as far as the powers and maybe duties of the board? Do you have any of those changes as far as fines or suspensions?
So a little bit. Right. Currently, we're one of the few licensing boards that can't fine its licensees. And that becomes an issue when you have a doctor who's violated regulations and needs to be disciplined for the violation of regulations, but you deem that they're still a safe doctor and we need to keep them in practice. That 12,000 licensees that I mentioned earlier, only about a little over 6,000 of those actually list their primary practice address here in Mississippi. So we need to keep as many doctors practicing as possible. A fine would allow us to discipline them for violating regulations without suspending them, which is very difficult for the board to do right now. So it's either a slap on the hand or suspend them. And so we're trying to create some middle ground in there where we can keep doctors practicing.
So you do have disciplinary duties, but there's not a lot of flexibility in it.
Correct. That's very true.
The membership, will that be changing, or terms of office, or any of that? All that's the same?
That'll all be the same. That's actually in a separate section.
Yeah.
And in years past, we've actually tried to add consumer members to the board. We decided to focus this year on just trying to modernize the Medical Practice Act and maybe deal with changing the membership of the board going into the future, and just kind of try to take this one step at a time.
The official name of the board is what now?
The Mississippi State Board of Medical Licensure.
And you want to change to?
No. We're not changing the name of it.
Okay, I thought I saw in here somewhere you wanted to change the board, the name of the board.
We just clarified some of the language in there.
I got you.
It may have just said medical board, and we clarified it that it's Mississippi's medical board that we're talking about.
Well, hopefully it will get more attention in the House and the Senate this year. Those are the things. I mean, they depend on you guys at the board to make those recommendations, and they ought to be considered at least seriously. I do want to go over to medical marijuana and some of your thoughts on this one. This is rolling in. We're getting closer and closer. There are a lot of people kind of worried that it's going to get out of control. We don't know. They are making some corrections. I want to talk more about that when we come back with Dr. Ken Cleveland, Executive Director, Mississippi Board of Medical Licensure. We'll do that in Ken Cleveland, Executive Director, Mississippi Board of Medical Licensures, where all of the movers, shakers, and playmakers appear here, and we thank you. Speaking of medical marijuana status, business license, we've issued 91 business licenses. This is the update as of, I think, probably late last week. I'm not sure if it's been changed. We've denied 4, return to action 10, cultivation issue 67, process issue 10. We've issued 879 work permits. We have issued practitioners 144. Patients, there are only 1,518 who have gotten their cards so far. There are 805 more that are in process. They have returned for action, 203 people. Only 12 have been denied. I know you guys have talked about this a lot. Where do you think the areas are of the greatest risk that this needs to be maybe more oversight than anything else? Is it the telemedicine with any of the rules and regulations there on how you get a card or any of the other vulnerable areas of this bill that the licensure board will be maybe speaking about or getting involved in?
So certainly when the medical cannabis bill passed, and that's probably one of the reasons for our increase in licensees, is we had a lot of people wanting to do telemedicine into Mississippi and to certify patients for marijuana. It specifically says in the Medical Cannabis Act that you can't do the first visit by telemedicine. We reiterate that in our regulations on certifying patients. So I think telemedicine, even with all that, we have seen a handful of practitioners already that we know about that are trying to certify patients via telemedicine. They're giving us fake addresses in Mississippi, addresses that don't even exist, to try to claim they're here in the state, just all kinds of stuff going on. We anticipated a big increase in this kind of activity, and so we increased our staffing and our investigators so that we would be able to look into all these new complaints that are going to be coming down.
There's no penalty for that, is it? I mean, we have anything on the statutes as far as penalties for providing fake information?
Well, it's applying false information in the trying to become a licensed physician in Mississippi is certainly against our regulations. And what usually would happen in a situation like that, if we discipline that doctor here in Mississippi for giving us false information, other states where they're licensed will do what we call mirror actions and take similar discipline on their license in that state as well. So it can have a big effect on physicians.
How many did you say were new licensures who have requested or been permitted to operate in the state? You said it's been an increase.
Just licensees or medical cannabis certifiers?
Oh, they have to say the certifiers have to be specifically for that only? Well,
so increase in total number of licensees, I would say over the past 2 years is somewhere around 2,500 to 3,000. We at the medical board, I think we have 107 physicians and PAs combined together that have registered to become certifying practitioners for medical cannabis.
Do they have to have bricks and mortar here?
They have to be able to have the initial visit in person, so it can't be done by telemedicine.
But they could set that up at a hotel lobby or a ballroom somewhere.
Theoretically, they could. I mean, certainly we would be interested if people are sitting in a hotel room certifying patients. We would not like that.
But is there anything you can do about it?
Only if we know about it. And then, what we would do is we would ask that certifying physician or PA to provide us documentation that they are practicing medicine correctly, that they're doing a history and physical, that they're doing, the appropriate exams, doing the appropriate labs. And then making sure that they do have one of the illnesses that fits in for certifying somebody for medical cannabis. So even if they're doing it out of a hotel room, there is appropriate documentation that has to go along with that. And certainly if somebody's doing it out of a hotel room, we would be interested in them showing us their documentation. If they're doing it right, then there would be no problem from the medical board. But, would you go see your internist in a hotel room?
Well, if it's a 5-star hotel and it's in a nice room with good food, people will do that, as you well know. I want to ask you, because looking at a workaround, much like the legal industry where you don't have to have the lawyer here, but you have to have somebody here signed on as whatever, just co-partner or whatever. Is that a possibility they could do, just sign on with a physician here?
I'm not sure I completely
follow. In other words, they could say they're a member of a doctor in Iowa who specializes in these and can do it almost in a boiler room operation, can sign on to some doctor in Benoit, Mississippi, and say he's part of that staff, He's there, but he's not in that office.
Well, if that doctor has done the appropriate continuing medical education to become a certifying practitioner, they can consult with anybody they want to on how they go about practicing medicine and getting advice from somebody that's out of state.
And they still have to have that first visit in the Benoit office.
They would still have to have the first visit in person. Yeah.
There are just is so many other things going on. Do we see any changes, do you think, or is there any bills that you guys are watching as far as telemedicine in this 2023 session?
No, I mean, it's still early on, and, we're still, we have people who are watching to see what all bills will get dropped and come out of committee this year, and then we'll fight the battles that we need to fight, or at least give our opinion on what we see as problems, so...
I love this family across the state. You always find that information on the C Spire text line. Cannabis certification has been advertised at the Batesville Coliseum. Well, I hope they're serving food. So,
well, I just want them to do it right. Wherever they do it, I just want them to do it right. I want them to examine the patient. I want them to take a history on the patient. I want them to certify them for the correct reasons. So.
Has the board talked to any of your cohorts in other states? And I know you tried to get an idea of where the weaknesses are just to be prepared. Even the legislators that I've talked to have done this. And I think they're all pretty honest with us by saying, Paul, we can look here, look there, try to protect this, try to protect that. And there's always going to be something that slips through and maybe indigenous to the state of Mississippi. But I guess you guys have looked at all the weak points on this, too.
Well, we certainly have tried to identify the weak points and address them. We have talked with other states that have either have had medical cannabis and now have gone recreational or still are at the medical cannabis level to get an idea of what we're looking at as far as complaints coming our way and what we need to be looking for to make sure that people are practicing medicine correctly. It's still the practice of medicine. The legislature and the governor signed the bill that calls it medical cannabis. So it is still the practice of medicine, and it needs to be done correctly.
I think most of I saw a film on this the other day, most of where some of the hospital emergency room calls are going to be is people who are with the edibles when the directions are apparently not as clear as they think they need to be. If it's only a small cookie and they think, well, I need to consume the entire cookie. Sometimes it doesn't work out right.
Well, and that can be true of a lot of medications,
yes.
Right?
Yes.
I mean, so people will take fentanyl patches and crush them up so that they can get all the fentanyl out of them at once. So they could end up in the emergency room as well. So, we're very fortunate in Mississippi. We have a lot of good physicians here, and we have a lot of very educated physicians that take very good care of our people. And so those are not the ones we're worried about. We're worried about the ones that are not doing a good job, who are not practicing medicine appropriately. And all we're trying to do is have the ability to protect the safety and health of the people of Mississippi.
We have a pretty darn good track record for rolling out some things in the state that are pretty caustic or could be. Casinos, as far as gambling is concerned, the lottery, and we've done sports betting and things like that. And we've got a pretty good track record on this, and I hope to God that this is the same way. I really do.
Well, we're certainly trying to do our part to make sure that this remains a safe field of medicine to practice in. And like I said, we're ready to do the investigations that are necessary to make sure that it is safe for the people of Mississippi.
Dr. Cleveland, thank you, sir. I would be remiss if I didn't say that your better half is a lot more outstanding than you are, and I say that from
I agree with you.
From her being my oncologist and giving me the news before Christmas that the cancer was not to be seen. An incredible person. We thank her so very much, and you for coming in. Appreciate it, sir.
We all know I married up, Paul. So.
I didn't want to say anything about that, but then again, you're a poker player, so you know where the odds are.
Yeah, there you go.
Dr. Ken Cleveland, I've known him for a long time, Executive Director now, Mississippi Board of Medical